Hi, I'm Mandy, and I hope that what you hear today will mean that you never have to go through the same experience that we did, losing someone that you really love to sarcoma. Like many people, we didn't have a very clear idea of what sarcoma meant. Our story began when my daughter Abby, at the age of 17, started to complain of a pain in her lower back, a severe pain. She went to her GP, who sent her for x-rays, and I knew something was really seriously wrong when we got a phone call to say that her GP needed to see her and he wasn't leaving the surgery until he'd spoken with her. When she came out, we found that she'd been diagnosed with a tumour in her pelvis. Abby was immediately referred to Professor David Wood, a specialist in bone tumours. A series of appointments followed, including an MRI and a painful bone biopsy. 4 weeks after that initial appointment at the GP, she was diagnosed with stage 4 metastatic Ewing sarcoma, with a cancer throughout her pelvis, ribs, spine, lymph nodes and lungs. Surgery wasn't an option, and so she embarked on a grueling 8 months of intense chemotherapy with 6 weeks of daily radiation treatment at the same time.
Despite knowing that it would not help change her own future, in the time left to her, Abby was determined to address 2 key issues: awareness and research. SOCAT2 sarcoma is the name that Abby created for her vision. It represents a commitment and dedication to fight sarcoma on these fronts.
Sarcomas are malignant tumours of connective tissue. The connective tissues in the body are those structures that hold you together, like bone, cartilage, ligaments and so on. They're rare tumours and distinct from the more common kinds of cancers such as breast cancer and ovarian cancer, which arise from the glands in the body. There are over 50 different types of sarcomas, all of them rare. Although there are many different types of tumours, they have a common method of presentation, so they will most likely declare themselves with a lump or pain or both of these, and it's important not to ignore these symptoms, as early detection can improve the chances of a cure.
Once sarcoma spreads, it becomes quickly critical and more difficult to treat. The greater the delay in diagnosis, the more invasive the treatment, and prognosis and survival rates decrease dramatically. 40% of patients will lose their battle for life within 5 years of diagnosis. That's 2 in 5 children, teenagers and adults who will not survive. Sarcoma is a tragic, deadly disease, and it's vital that it's detected as early as possible. You need to know what to look out for.
The symptoms are often insidious, so they're not particularly painful. They may have been a lump, they may be quite slow growing, so it may have been there for a while. The lump may not be seen by you, it's on your back, so you can't see it. It may be a pain in your leg that you just ignored because you assumed it's a bit of arthritis or the sporting injury that you got last month. But it doesn't go away. So the key is, if that lump doesn't go away, that muscular ache or pain that you've been ignoring doesn't go away, don't ignore it. It might be nothing, but it might not.
I'm no stranger to sports injuries, and this made me wonder how often people might ignore a lump or an unexplained pain or fatigue without getting it checked out. Yeah, I really didn't know what the term sarcoma was, or actually what the disease was, and actually how many young people actually got diagnosed with it and didn't survive after getting that diagnosis. There's one message as an ambassador of this foundation I can give, is to know yourself, check yourself and also see a doctor. And if it doesn't feel right, just keep checking.
If you have a lump with or without pain that remains or changes after 3 weeks, pain in the back or in a limb from no apparent cause, extreme pain at rest, especially at night, fatigue or weight loss, then please consult a doctor. If you ignore these symptoms, the consequences can be devastating.
I thought that I was invincible and I was, always, nothing could bring me down, but I was diagnosed with an osteosarcoma when I was 17 after I broke my leg. Found out the reason that I'd broken my leg was because of the osteosarcoma. I underwent 2 rounds of chemotherapy. The tumour had still grown. Then I had to have my leg amputated, followed by 9 months of chemotherapy. So I wouldn't be here if it wasn't for the support team that I had around me, not only the doctors and nurses and hospital staff, but also my family and friends who were there for me every step of the way.
Louise Wheeler is an example of a proactive young person determined to pursue her own feeling that something was seriously affecting her. She persisted in seeking answers and, as a result, was treated by surgeon Richard Carey-Smith, whose dedicated team saved her leg from amputation. Limb salvage becomes a real option if bone cancer is detected early enough. Doug Hodson counts himself very fortunate. After investigating chronic pain, a large sarcoma was detected. The Hollywood Charles Gardner sarcoma team, led by Professor David Wood, treated and removed the sarcoma on his left side 4 years ago. The team has monitored and assisted Doug's recovery ever since, and he credits the team with his recovery. From diagnosis to survivorship, Socket to Sarcoma is committed to ensuring gold standard holistic care for any West Australian and their families who are affected by sarcomas. With donations, fundraising events and your support, Socket to Sarcoma will continue to provide the resources for the essential research needed to fight and hopefully find a cure for sarcoma.